Indian health system is not black or white in texture. It is evolving over time. There's lots of challenges and opportunity, and DIPH we have tested in number of years of research.
My name is Shumibal Datto.
Ajit Mujumdar, Dr. Somnath Mukherjee,
Swagatendra Narayan Basu,
Myself, Dr. Shokant Vishwas.
Gautam Maiti,
Dr. Prolay Acharya,
Obviously, we already captured the first ANC or the PW register for the first ANC through the HMS portal, but we have not captured the third ANC, the delivery, the newborn.
Data is very important. So, when we get the data, so in the next review meeting, in the district level or in the block level also, we analyze, we discussed what is the gap laid down.
data collection, analysis, interpretation and action taking is already included in our system. But the problem is that our health workers from top to bottom, they are doing so many works. During that time, that some important focused area is not being taken care of regularly.
With respect to data, what happens is many data is actually collected at various levels of the reporting units. But when we look into these data, they are not presented as a single clear platform in a clear way such that we can take action. So the issue was data was available and data was being collected, but actionable items were not being highlighted.
No, actually the data is analyzed in such a way, actually we compare the datas. We walk in the say for instance in the institutional case of institutional delivery, there are work schedule, there are plannings given to the frontline workers of the health sector, and they are advised to work accordingly, and how it is improving. Say for instance how the it's improving from the home delivery, how it is decreasing from the last previous years to these years. So this comparative analysis will help us whether the work process is going on or whether we are succeeding in our programs actually.
We get a monthly report from our reporting units, which we culminate in the system which they have developed, which is a wonderful thing. Actually, it's a server-based online system where the files have to be uploaded with all these reports which are available from the blogs. What we do is we break it up into 3 or 4 sectors. One is reporting with the basic data. One is what is actionable, what items are being done. And after that, what we look into, what is the thing that, say, the monitoring activities are being done on these actionable items which has been identified. And once we go through the entire system, the system is beautifully developed. So we can even generate graphs, we can generate reports from that system, from which we can clearly put out the next actionable items are clearly planned from that data which is available to us.
For awareness in the blocks, we find that some blocks are performing awareness programs in a definite way, and some blocks are not performing at all, which is reflected in the DIPH data. So we sit with the BMOHs of those blocks and accordingly instructs so as to how to increase the awareness method or awareness meetings, so that people is made aware of these things and the program can be, the target can be reached actually.
The definitions of data, which was not very clear to our block level workers, got to be more defined and refined with this, going through this process of DIPH. So after that, once the 3 cycles have been completed or is on the process of being completed, what we see is that the data definitions, the blocks, the reporting units, they are very much interested now with exactly the data definition, and they are going through them very carefully and meticulously before transmitting them to us.
I was a team leader for the first 2 cycles. First cycle was exclusive breastfeeding, and the second cycle was the antenatal care, special emphasis on 4 TNC care. So being a team leader, so naturally I would think about how to develop the data and how to analyze and what is the problem lies behind, how we compile the data, how we just getting the data. So it is very important.
In our district, I think it will be sustainable because we have already brought good result in this regard, and it is supported by our district administration and others also. And as North 24 Pargana, North 24 Parganas is a pioneer and pilot, I think it will be helpful in another districts also, and it will be very much helpful in case of our state also as a whole.
The district is well oriented with data informed platform on health. They are already well informed and well oriented, and they are taking action has already been taken, and it has improved. Like exclusive breastfeeding, it has improved. ANC checkup, it has improved.
Previously, the health is the only concern of the health department, but now the health is the issue of the whole district, where the other departments like district administration and child development, women development, and also panchayat department also come together and play important role to reach the health target of the district.
Before DIPH, there was a data collection process going on, as that is required for national health missions requirement, as they maintained a huge database. But the problem was the quality of data was not ensured. But after the DIPH process has started, especially the district level officials, they are able to understand the importance of the data. They are able to monitor the each and every part, every single angle of those data. Regular monitoring, regular validation of data processing is looked after, and they have also identified very important data sets are not been tracked or not been reported in HIMS.
When DIPH has been implemented in this state, it has been implemented through a very close collaboration with the district level stakeholders. Their inputs, their suggestion has been incorporated when we started testing this method. And the most satisfying thing is that we have found the district level stakeholder using this method monitor their progress.